Good afternoon, everyone. I'm Brenda Hemmelgarn, Department Head of Community Health Sciences, and thank you, one and all, for attending. This is a great turnout, and I think that demonstrates right there the commitment to the department. And we're going to have a very exciting afternoon here today. I've been in my role as Department Head for a year now, and so thought it was a good opportunity to bring individuals together in the faculty and staff and other students together to talk about the department and plan as we move forward. And we had a huge long list of things that we wanted to accomplish, and they just looked at me and said, "Brenda, you're crazy, like you have to focus." And I said, "No, we want to do everything if we want. There's so much that we wanted to do." So we've got lots of great ideas and other things that we want to focus on in the future, but today the topic is going to be on our students and ways that we can actually increase and make our programs, our many training programs that we have within the department, even bigger and even better. So part of the purpose of today is just to understand and become familiar with the different training programs.
The Bachelor of Health Sciences program began in 2005. It was thought about and conceptualized in order to respond to needs within the human in the health human resource workforce. And so the Bachelor of Health Sciences was conceived to have biomedical sciences, bioinformatics, and health and society as the three streams. What distinguishes us from other programs is that we are a research-intensive undergraduate program, and we are unapologetic about that.
The program started in 1979. We were part of the Faculty of Education at that time. And our mission statement is CRDS is a diverse program of academic and professional inquiry aimed at interrogation of understandings and experiences of disability as a social, cultural, economic, and political phenomenon.
So we currently have 14 residents in our program. We have an intake of 3 per year, so we take 2 Canadian medical graduates and we have a spot for 1 international medical graduate.
A graduate degree is an advanced degree, as you know, and it's in our program, master's and doctorate program. It typically requires earning an undergraduate degree, but as many of you know, we have students that enter our graduate program who have already master's degrees as well.
So epidemiology here in our department is a set of research methods and a common language that ties many researchers together. May include many whose primary appointment is not within our department. And he refers to EPI as a cluster, and it's important because it provides us with a structure where we can supervise our students.
The goal of our program is to advance the development of and correct applications of biostatistical methods in medical research through education, training, and research collaboration.
So how do we really be effective in positioning educators to be able to talk about the social determinants of health, while many times we think of population and public health as a teaching group, as about being the graduate program. Over the years, consistently, we've had a number of discussions about the health and society stream within the program, and I think we can look forward to more of that because we're an important curriculum support for these practicum students, but also because a number of the faculty who align to our specialization are also active.
We do offer 3 graduate programs. We have a course-based master's, we have a thesis-based master's, and we have a PhD program. Very intentional reasons that we do that, really linked to our theoretical and professional orientation as a program.
So we have a lot of overlap with other different disciplines, namely epidemiology, also health economics, but really any of the specializations, because so much of the courses that the student take and the thesis that they do are based on their own particular areas of interest.
Then the second part of the program today is to establish strategies. We're going to have some breakout groups, and we're going to look at ways that we can make our programs even better. So how do we develop and maintain the best quality training programs that we have within the department? let you know that it's not just about a retreat, nothing happens after. At the end of this, we will be developing a report, but it's not just going to be a report that's going to be put on some shelf somewhere. We're actually going to have action items from this. And the report will be given back to each of the training programs, and we'll work with them to actually fulfill some of the initiatives and the ideas that have been brought forward today. And another purpose is to profile some of our more recent recruits to the department and have some TED-style talks.
Having a pre-existing condition or being at a high risk of developing an obstetric condition can cause a lot of anxiety in the woman as she worries not only what this means for her health, but what it means for the health of her baby. Now, personally, I find pregnancy to be a very interesting exposure or time period to study because it is a time-limited event, and exposures during pregnancy impact not only the mom but also the baby or babies, depending on what type of gestation it is.
I try to hire people with lived experience as part of the research team because I think there's an authenticity and a sincerity to that conversation when somebody who's been through it is in the room with you. And so in my 4 projects, I actually have 13 research assistants, and I have to do that intentionally because one of my projects, we're doing surveys with 300 people living in shelter and under bridges and rough sleeping, and I only want RAs that have worked frontline in a homeless shelter.
CHS is the place to be, with so many awesome faculty. Some of us study obesity and others health equity. I think it's very plain to see